Thank you. Welcome back. It is now my great pleasure to introduce presenters for the second paper today, authors of the Issues paper, Review of Early Childhood Parenting, Education and Health Intervention Programs for Indigenous Children and Families in Australia, Professor Jennifer Bowes from Macquarie University and Dr Rebekah Grace from the University of New South Wales. Jennifer is a professor at the Institute of Early Childhood, Macquarie University, and a founding director of the Children and Families Research Centre, Macquarie University. She has a research background in educational and developmental psychology and has led several major research studies. These include 2 childcare choices research projects, a longitudinal investigation of the effects of multiple and changeable childcare in the first 3 years of life on the development of young children, and an investigation of the childcare choices and attitudes of Indigenous families, both funded by the New South Wales Department of Community Services. Dr Rebekah Grace is a Senior Research Fellow and Program Manager for the Early Childhood Research in the Centre for Early Childhood Research in the Centre for Health Equity Training, Research and Evaluation at the University of New South Wales. Please join me in welcoming both speakers. Thank you.
Well, good morning, everyone. We wanted to begin by acknowledging the traditional owners of the land here, the Kaurna people, and paying our respects to their elders past and present. It's a great privilege to be here today. We were very pleased. We want to thank the Australian Institute of Health and Welfare for the opportunity to be able to read about all the programs in the early childhood years that were being undertaken with Indigenous young children and their families. It was a real eye-opener. I'm going to start talking, and then we're doing a bit of a tag team here. So Rebekah's the expert in health, so she'll be coming in on a lot of the health issues and other issues as well. But just to get you interested, we were reading about all these programs, and we were amazed at kind of the creative things that were going on around Australia in terms of programs in the early childhood years. For example, one of the programs that in the health area was instituting Olympic swimming pools in areas, and this was found in Western Australia to improve eye health, ear health and skin conditions of young Indigenous children. Now, the research was, the swimming pools were built and the research was done in other states, and it wasn't such clear outcomes, but who would have thought of building a swimming pool as a health intervention? We found that very interesting. One of the ones that I came across that was here in South Australia was developed by a sort of think tank group here in South Australia, and it was called Family by Family, and it was about helping families in a sort of peer mentoring capacity. And it was set up for very disadvantaged families and communities. So it wasn't Indigenous specific or anything, but it was training people who had maybe had their children left home and they were in a good position to mentor the needy families in their own community. And that seemed to me like a really interesting approach. And the third one I wanted to mention was Families as First Teachers, which is happening in the Northern Territory, which is in the early childhood education sector, where they started off with playgroups for Indigenous families to bring their young children along. And then as that had been going for about 12 months or so, they thought we need a stronger educational component, and they brought in people to help institute the Abecedarian program, which is an American-based high-quality, high-impact early childhood education program, and incorporate that in the Families as First Teachers program. Now, a lot of these, while the swimming pool one I mentioned has been properly evaluated, these last two I mentioned have had initial evaluations, but the big evaluations are sort of coming later, so we can't really say that much about them. Do they work, you know, in terms of the closing the gap? But just the variety of programs we reviewed was fascinating, really. It was mentioned in the previous presentation how important those early years are for intervention in the closing the gap kind of agenda, I guess. Trying to get in those very early years when children are young and developing, their brains are developing, and not only with them but with their families as well, in the areas of health, parenting and early childhood education, which were the three areas that we chose to focus on. Like the whole Closing the Gap agenda, we were trying also right from the beginning of writing this paper to take a strengths-based rather than a deficit-based approach, and we hope that we've achieved that. So although in this presentation we're going to do a quick run-through of where the gaps are, which is kind of like the deficit side of things. Okay. So our aim in this paper was to review intervention programs that were focused on the early years of life. And I've put in brackets there in the context of other more universal services, because we agree with Dr. Carmel that these programs, we keep hoping that a program will solve everything and do everything and make the difference. It won't. You can't get a program operating in that way. What you need is universal systems that help close the gap. So you need really good education systems, schooling systems, health systems and so on. These programs hold a lot of promise, and they might grow into sort of sustainable elements of the health system, the education system and so on. But by themselves they can't really they're not going to be the full answer. We treated the early childhood years as just prior to school entry, and that was just for the convenience of our review. Generally, internationally, it's regarded as the years from birth to 8 years old, but we were really talking about birth to 5, or wherever school entry was in each state. We were looking at the range of available early childhood programs, trying to get as much information as we could about how many programs were operating and so on, but we were restricted to programs that some people had published something on. So if we've left out favourite programs of yours that we couldn't hear about, we really were reliant on the written word, if you like. There's a lot more programs going on out there. We were looking at the evidence base for these programs. To what extent could we say that they worked, or it looked as though they didn't produce outcomes, at least in terms of the research that was done. So what was the research like on these? What did it tell us? And the three areas, as I said, were parenting, early childhood and education and health. So in terms of the background, there is a lot of evidence for gaps between Indigenous and non-Indigenous Australians relating to parenting, early childhood education and health in the early years. And these gaps, as was spoken about before, are the gaps that end up, you know, producing the big employment and educational gaps we heard about in the first papers today. I haven't seen anything about Indigenous children's development we couldn't find any data on Indigenous children's development from birth in those early childhood years and how much the gap was with the non-Indigenous children, but that sort of data is actually coming out in a project that Rebekah Grace is involved with at the University of New South Wales, with a longitudinal study where they've been gathering this data in an Aboriginal sample over time. So, yeah, but that's not our concern today. But what I have seen is work coming out from the Australian Institute of Family Studies that where very disadvantaged groups are are looked at. So low-income families, which would include quite a few Aboriginal families, which shows that there's no gap between the development of children in the first 12 months of life, but then the gap starts. So it starts from 12 months and it gets bigger, and so that at school entry there's quite a gap, and then it just keeps going. So if we're going to intervene, we're going to close the gap, you've got to start right from the beginning, really, once children are born, or even in pregnancy. One of the things we'd like to make comments on about the research that we looked at, the research base is largely descriptive, giving percentages of people doing this, that and the other, or describing programs. And also the sort of gaps we saw in the research base, I guess, is that there's not much longitudinal research, except, of course, for the big government programs like the longitudinal study of Indigenous children, which is coming up with some useful findings. But apart from that, there's not much longitudinal research going on, and there's not much research on urban Indigenous families, a lot on remote families. So that's just it by way of general comments. Now what we'd like to do is look at our three main areas and tell you a bit about what the gap is and then what we know, and then we'll go on to what sort of programs are addressing these in each of those three areas. So this is the deficit part of it, but it's just reminding you of things you've probably seen before. So, for example, in the field of parenting, there are, for Indigenous children, there are higher rates than for non-Indigenous children of substantiated abuse and neglect. There's more Indigenous children in out-of-home care. The intergenerational effects of the stolen generations have been talked about in regard to parenting. So a lot of Indigenous parents, grandparents and so on have been brought up in institutions or have been moved around in foster care and have had very disrupted parenting experiences themselves, and this has affected their ability to parent their young children. On the positive side, the Footsteps in Time, or the longitudinal study of Indigenous children, is saying that talking to the families, a large percentage of the families, 85%, say that they come from strong families. So there's a perception there that those families is a strong unit. And then other things, high unemployment, low education amongst parents, and high exposure of children to major life events that would commonly be called risk factors for development are happening in Indigenous families. So that's kind of to provide some sort of reason for programs in parenting, some sort of background. And I'll talk about the early childhood education, and Rebekah will tell you about health. The interesting things about early childhood education was a third of the children in the LSIC sample attended some form of childcare in their first year of life, and similarly a third attended a playgroup with a paid facilitator. So they're quite high percentages. You'd like to see them higher, but that's an indication of the kinds of early childhood education a lot of Indigenous children, young children, are attending. So there's a potential there for maybe adding more of an educational component into what's happening in those settings. And then there's the policy for access to preschool for all Indigenous children in remote communities, and for that preschool to be run by a qualified early childhood teacher. And that again will be an excellent move in the early childhood education field. And then the health.
Hello everybody, this is also information that will probably be fairly familiar to you, but when we're talking about health outcomes for Aboriginal children in those very early years, a lot of the focus is on early birth outcomes. So right from the beginning we know that the rates of prematurity are higher and low birth weights, and we know that Indigenous mums often engage late in the pregnancy with antenatal care, and there's lots of reasons for that I'm sure you're familiar with in terms of engagement with services. We know that often Aboriginal babies are born to mums who are more likely to smoke and use alcohol during pregnancy and have low levels of education. I mean, these are the kinds of the statistics that we're dealing with, I guess. Breastfeeding is also potentially an issue, although the findings are a little mixed. So it seems that urban Aboriginal women, they may be less likely to breastfeed, although there is some research. I'm not sure if you're familiar with the Western Australian Aboriginal Child Health Study, but that study suggested that perhaps in rural and remote areas, Aboriginal women were more likely to breastfeed and sustain breastfeeding over a period of time. So there's some, it's an issue. Probably a good news story is the immunisation story, where it seems that immunisation rates are good and comparable for Indigenous children to non-Indigenous children, with perhaps the only little concern being that often the vaccination or immunisation of Indigenous children sometimes comes a little late, so they run behind schedule, and that does potentially leave them at risk. But mostly I would identify that as a pretty good news story. Also in terms of hospitalisation and injury and such, we know that Aboriginal children are more likely to go to hospital and to be there for longer periods of time. Skin conditions come up all the time, and we know they're high in Indigenous communities, as does hearing, and the otitis media issue is a big one. And we have estimates anywhere from 10 to 67% of kids, Indigenous kids, who have otitis media, and dental caries is the other big one. So at this stage, at this very early stage, we don't do a lot of talk, I suppose, about the chronic illness and chronic health issues that come up later. The focus is pretty much around those issues. I was going to talk about method as well. So we did, as Jenny said, we did rely really heavily on what was written and published. So we're conscious that there are, lots of stuff going on out there, and perhaps we haven't, accounted for it all, but we think we've got a pretty good sample. In terms of the selection of those papers, we really focused on the Australian literature. So we did try to draw in literature about other Indigenous people in the world. So we did pull in literature from the US and Canada and New Zealand, but our very strong focus was on Australian research. Also, obviously, targeting those early childhood years, so up to school entry. We were looking for programs that were quite formal and structured, obviously that were related to the three main focus areas of the paper. We're also looking for programs that had been evaluated and those evaluation results made public. We limited our search to research that's happened in the last 10 years. So, of course, there's lots of stuff that's happened prior to that, but we've tried to focus on the most recent things that have been published. We looked at both mainstream and targeted services, but when we looked at the mainstream services, we were really looking to see whether they reported some findings around Indigenous children who participated in the program. In terms of locating that relevant literature, we looked at electronic databases, we consulted with representatives of the relevant government portfolios, and we also did a wide reading of review policy and position papers. Some of the programs that we found addressed, there was overlap, addressed more than just health or just early childhood education. So when that happened, we included those programs in the review under both of those areas of focus. So when you read our paper, you'll see that there are some programs that come up in more than one section. In terms of the quality of research design, we decided to use the NH and MRC levels of evidence table. I don't know if this is something that's familiar to you, but I'll show you what it looks like. National Health and Medical Research Council, obviously their focus is on health research, but it's not a bad guide. And of course, understanding the quality of evidence is really important. And sometimes it's something that's not well understood, and sometimes we're quite surprised by what's called evidence, but we wouldn't really normally consider to be evidence of a change in outcome. So we thought this was a nice structure to put around the work that we did. So in terms of level 1, what's considered really strong evidence is when there has been a review of all relevant randomised controlled trials. So you probably know that randomised controlled trials are held as the gold standard. So if a program has level 1 evidence, there's been multiple RCT, randomised controlled trials, and there's a review of those. And we didn't have any level 1 programs that we were able to identify in our review. Level 2, won't go through this too tediously for you, but this is when there's at least one good randomised control trial, and we also didn't find many of those. There were a couple, I think. Level 3, is when there's pseudo-randomised control trials, moving down to research where there are comparisons groups, cohort studies, down again to single-arm studies, without a parallel control group, and then level 4 is evidence obtained from case series, and, particularly if there's a pre and post element. I don't want to go through that too laboriously because that could be like a whole 1-hour lecture and perhaps you'd all be bored to tears, I don't know. But it was, you can read a little bit more about it in our paper, and it's the structure that we impose. So we were really conscious of looking at the quality of the evidence that's available and how convincing, I guess, it is, or how rigorous it is in helping us to understand whether outcomes changed as the result of the program.
We'll move on now to tell you a little bit about the range of programs that we came across, and we kind of found it easier to break it down into categories. So within the parenting area, we identified mainstream programs that were meant to benefit all parents in a particular area. An example of this is the Communities for Children program, which was a national program that was held about 5 years ago. There was a big evaluation of this where they actually identified disadvantaged communities around Australia, put in money to set up programs that could be chosen by the community, programs that would advantage families with young children. So that it was up to the group. So there were health programs, there were speech therapy programs, there were opening up the parks for families programs, all sorts of things. And then looked at, after 3 years, had it made a difference to children's development, to parenting and all sorts of things. There were also programs that were Indigenous specific, so they were set up for Indigenous families and for Indigenous parenting. An example of that is Let's Start, a program that's been run in the Northern Territory and in Queensland, which was a program that was teaching Indigenous mothers how strategies to control difficult behaviour in their primary school, or in their young, sorry, it was the young, their young children, and finally, there were home visiting programs, which is quite a common model for parenting programs, where someone goes round to visit families in their homes on a regular basis over a period of time, and the program continues and has a sort of like a it has a longer term effect, so it's not a sort of one-off thing. It goes over a period of time. An example of that is the HIPPY program, which I'm sure you're probably familiar with, that is now being used. It's a program for children when they're just about the year before they enter school, where home visitors come into the home and teach the parents how to do sort of school readiness work with their child in the year before they enter school. It's a program that's been used around the world. I think it started in Israel, but it's been adapted in Australia for Indigenous families, and it's been trialled, and a big research project done on that. And as a result, I think it's being rolled out across Australia in Indigenous communities. So that gives you an idea of the sorts of parenting programs. In our paper, we've got this table at the back that goes for pages, and it tells you all about each program we looked at and the evidence base for it, so we'll refer you to that. But basically, this is a summary of what we thought about the evidence for the parenting programs. There were some that had a high level of, on that NHMRC scale, but of the 13 we reviewed, 7 were at level 4 or below, which was sort of below that table. The more rigorous designs were for programs called Brighter Futures, Communities for Children, the Indigenous Triple P program, Let's Start, Men in Families, and the Hippie program. The outcomes for the parents after being involved in these programs more often involved improved knowledge about children and their development and changed attitudes, so like more confidence in their parenting and so on, rather than changes in behaviour. So they weren't really finding, changes in what parents did with their children, and that may be a function of the time it takes for that sort of change to come through. Really all the programs that we reviewed had been well received by the communities, and the Indigenous specific programs all had extensive community consultation, which I think is a real key to these programs working. Okay, the early childhood education, we had 4 types of programs we identified there. The mainstream programs, similar to what we talked about before, big programs that where findings were given for Indigenous families as a sort of subgroup. Indigenous specific programs, and that Families as First Teachers I spoke about at the beginning is an example of that. Programs on specific aspects of learning, for example, Early Start or Let's Start is another name for it, in the Northern Territory with the challenging behaviour of children, and specific formats. So there have been evaluations of things like the playgroup program and looking at the wide range of transition to school programs for Indigenous children. Of the 10 programs here where research was found, 7 were at level 4 or below, so they weren't sort of highly rigorous research programs. Now at first, Rebekah and I, who are researchers, are saying, oh, these researchers, they don't know what they're doing, But it's not that. I think often there's not much money for research. Most money in programs goes into actually doing the programs and on-the-ground stuff. If there's money set aside for research or evaluation, it's a small amount, which can't really pay for more than much than like interviewing the people who are running the program and saying, do you think it worked? Or, some of the programs are like that, or interviewing some of the participants saying, were you happy with it? We were looking for much more rigorous research than that. Were they measuring child outcomes? Were they measuring parenting outcomes and so on? The more rigorous designs in the early childhood area were Communities for Children, Hippie and Let's Start, the ones that I mentioned before. Most of the outcomes found in the early childhood education, one where you actually found outcomes that were coming out in the program group compared with the comparison group, were about child behaviour. So nothing coming out about their learning. Often it wasn't measured. So there's a lot of work to be done in this sort of area. The conclusion there was within the early childhood education programs, Indigenous specific programs, supported play groups and transition to school programs seem to offer the most promise for the early learning of Indigenous children. And now with the health programs.
I'm going to skip over this. It sounds like we're about to run out of time. So I would refer you to our paper. There's lots of information and detail in there. I guess just to say that we split the paper, so there are obviously some programs that are very directed towards, particular disorders or diagnoses like, asthma or skin conditions, and so there are some, obviously there's that kind of research. A very large and growing and important part of the research within the health scene is around maternal and infant early childhood services. I know that you have an excellent program running in South Australia, which is a home visiting program that commences when babies are born and continues until they're 2 years old, and it's delivered in partnership with Aboriginal health workers. So there's some lovely examples of work that's happening in that area, and it's a fast-growing area with some really good outcomes for some of these programs. I guess I do want to emphasise the importance of broad health interventions, particularly those that take very seriously the social determinants of health, so that, partnerships between health and housing, for example, health and education, or, all of the range of work that happens that isn't about just particular diseases or solving particular problems, that actually seeks to embrace and understand and address the complexity that surrounds, some of the health outcomes and the gaps that we're seeing where we want to make progress. And that's probably the most fascinating area for me, and I suppose in my personal opinion the area where we might actually, if we put some attention here, we'll start to see some real long-term change. We can't hide from the complexity of the issues that surround those outcomes. So before I get donged completely and told that I must stop, I really want to, I'll skip over that if that's okay. I really want to make a comment about program implementation. This is where I feel, most passionate, and I know that it's a discussion that you people are probably familiar with as well. But programs are only successful when they're delivered in ways that are meaningful to communities. And we know that Aboriginal communities are different. There's no such thing as the Australian Aboriginal community that embraces all Aboriginal and Indigenous people. We know that communities are different, and there's different cultures and views within different Indigenous communities. And so the importance of delivering programs in ways that are meaningful, it's the only way that they can be successful actually. And there's example after example of programs that potentially looked interesting and could have achieved a lot but were unsustainable and a poor match with the needs of and the values and the priorities of the community. So the way that I sort of like to think about it in my shorthand way is the importance of safe people, safe places and safe programs. So safe people is all about the people who are involved having the endorsement of the leaders of the community and other members of the community, having them engaged in a meaningful way in program development and implementation. I've written capacity building there, but I prefer the term capacity engagement. So employing local Indigenous people and engaging their capacity. Of course there may be some capacity building and learning of new skills, but there's so much that they have to offer in terms of the way that we deliver our programs. So it's much more about engagement with the capacity that exists within the local community. And to do that in a meaningful way, I think that it's easy to slip into a tokenism, and that's hugely concerning and a great loss in terms of engagement of the capacity and the other coming back to us. And also the right non-Indigenous staff, and making sure that we do have people who are working within communities who genuinely understand the community and are willing to work flexibly and to adapt their practice in a way that's relevant to local communities. Extremely, extremely important. Safe places, so the willingness to deliver programs wherever the people will receive them, whether that's at home, whether that's under a tree, whether it's at the medical centre or in a park, having flexibility around the way, the places, the physical places in which services are delivered. And then, of course, safe programs. So ensuring that they are strengths-based, that there is flexibility, that they are sustainable and meaningful within community, and that they are able to be adapted and link with other programs within the community. I could give many hours worth of rant on this topic. It's probably my most passionate area, and what I think about most is the way that we implement programs in a meaningful way. So I couldn't sit down till I'd at least had a mini rant, and so I appreciate you letting me do that. Oh, how do we move on? Oh, sorry, I might have messed it up. So I think we really have run out of time. So given I've had my rant, I feel quite satisfied now. I'm happy to do that, but we can address any questions that you have.
Thank you, Jennifer and Rebecca. Can I just ask if you can hold your questions until the next speaker finishes? Thank you. I'd now like to introduce the presenter of the third paper today, Dr. Sarah Wise, Fellow at the University of Melbourne and Berry Street Childhood Institute. Sarah is a developmental researcher with many years of research, policy and program development experience covering a wide range of issues relating to children, parents and families. Her special interest areas are early childhood development, child and family welfare and the engagement of social policy and practice with evidence. Sarah has held senior research positions in the government and not-for-profit sectors and operates her own business called Research Beautiful. Sarah currently holds a joint academic fellowship within social work at the University of Melbourne and the Berry Street Childhood Institute, where she works to integrate academic research into social systems and programs designed to support vulnerable children. All yours.
Oh, you forgot the conclusions page too. Well, even more. Well, good morning. It's a great pleasure to be here this morning and to present the paper that I prepared for the Closing the Gap Clearinghouse. Before I go any further, I do want to acknowledge the traditional owners of the land on which we meet, the Kaurna people, and pay my respects to their elders past, present and future, and to extend that respect to any Indigenous people here today. Before I go into my first slide, which gives you a bit of an overview of the discussion, or what I'm going to present for the next half hour, I think I need, just like Jenny did, need to define what I mean by early childhood development, because it means something a little bit different in the context of my paper. Early childhood development, as it's understood in the international literature, is a comprehensive approach to policies and programs for young people from before birth, so in the womb, to 8 years of age, their parents and caregivers. And it's aimed at ensuring a foundation of developmental health and good outcomes in the early years of life. Yeah? So it's really an approach to policy and programming. And it's aligned with agendas relating to maternal and child health, early childhood education and care, child and family welfare and pre-primary education. But it really is a very broad and very sweeping agenda. It's about ensuring those holistic and interrelated developmental outcomes, that foundational health which we know is important to good outcomes across the entire life course. So that's what I mean when I talk about early childhood development. I don't have somebody to co-present here. I don't have a joke to warm you up so that you feel better able to receive information. I certainly can't play the didgeridoo. But I have tried to match my dress with the slides there. So, and I really truly did try and do that as a visual aid for you, so that just to kind of keep you a little bit alert till we get to the end of this session. So there you go. So in terms of what I'm going to discuss, really three things: what we know about early life outcomes for Indigenous children and the context for Indigenous early childhood development. I'm going to summarise that as ECD and hope that you understand that. There's a little bit of overlap in terms of what Jenny and Rebekah have already presented, but it is scene setting. And then really dive into localised early childhood development as a strategy to close the gap in disparities between early life outcomes of Indigenous and non-Indigenous children. So I want to explain what it is, why I think it works, or localising the ECD agenda works to close the gap. Then I want to talk about the associated conditions for early childhood development, how you actually implement it in practice, and some of the outcomes that can be achieved at a local systems level and community level through implementation of a localised approach. And then speak very broadly at the end about the sorts of strategies that might fit within a local ECD change agenda. And I think this whole topic of localisation really builds on Rebekah's rant about program implementation and the need for very tailored, community-oriented and specific an approach to the early years. So what do we know about early life outcomes for Indigenous children? As I'm not going to labour this because Jenny went over it, but there is a very clear trend in the data for poorer outcomes for Indigenous children in the early years of life. There are clear gaps in mortality rates. The Indigenous mortality rate is twice that of non-Indigenous children. There are poorer physical health. We know that twice as many babies born to Indigenous mothers, a low birth weight, compared to babies born to non-Indigenous mothers. If you look at the Western Australian Aboriginal Child Health Survey, their data relating to emotional behavioural functioning, there are wide gaps in terms of a risk for clinical disturbances between young Indigenous and non-Indigenous children. And in terms of language and cognitive skills, when you look at the AEDI data, and I know some people here are representing the AEDI in this state, and the NAPLAN data, again, those sorts of statistics shows gaps in that area of development. And we know that we're seeing these disparate outcomes because young Indigenous children, on average, are overexposed to risk factors, things that happen within or the parenting that they receive, the problems that the parents experience, the disadvantaging processes within communities, and the inequitable access to early childhood development programs as well. These are all risks that occur for Indigenous children that disrupt the normal processes of child development, and from the very early stages start to show those disparate outcomes. And I would actually suggest that the gap begins in the womb. Well before birth, we know that there's a problem with prenatal alcohol exposure and other things, as Rebekah has spoken about in terms of health, that really the disadvantage starts well before birth. So what do we know about the context for Indigenous early childhood development in Australia, the context for policy and programming to achieve this overarching goal of healthy development in the early years? There's a wonderful upside. The science of early childhood development, Tom gets it, Jenny gets it. I mean, in high-income countries and developing countries, the science of early childhood development is very well understood and accepted. Investment in the early years can produce benefits across the entire life course. And in Australia, recently, we've seen an unprecedented level of investment and activity in services, policy and national cooperation around the early years. We have an overarching national plan investing in the early years, and of course the Closing the Gap strategies, where 3 of the 6 Closing the Gap targets relates to early childhood development. There's been an unprecedented level of investment in new activities and services in states and territories and nationally. So the political climate is actually very favourable and positive for this area. But there is a downside in terms of delivering policy and programming for early childhood development. It's a very complex thing to do. I've heard a number of times throughout this seminar, a single program won't solve it. It's not like dental care is when we can put fluoride in our water and, problem solved. Child development is a very complex process. It's multidimensional, physical, cognitive, language, social, emotional, and multi-determined. There's a range of different factors that influence development. And deciding where to target our investments, is it in early learning and care, is it a parenting program, do we pick hippie or let's start? It's actually a very complex thing to try and do. Child development is very complex. And we've already heard too that communities are very complex. They vary in terms of their social, economic and cultural dimensions. The capacities of local service systems differ, and the concentration of Indigenous peoples in communities varies as well. We have discrete Indigenous communities and we have Indigenous people living in heterogeneous urban communities and everything in between. So communities and their needs and issues are obviously very different. They're complex. Indigenous culture and history obviously is very complex and a challenge for delivery of early childhood policy and programming as well. And we've already heard about policies that have created trauma for Indigenous people and the intergenerational effects of those. So these are all things that are in the mix. And of course, the funding for early childhood development is complex as well. There's not an integrated funding for early childhood development. There are pockets of money and streams of money and siloed money for different parts of what might be an early childhood development system. So we have, as I say, political will and a really strong investment in the early years. but some real challenges and complexities as well in terms of achieving that sweeping goal of healthy development. So I guess that's where localised early childhood development comes in. And what is it? And very broadly, I would say that it's about localising that early childhood agenda. It's about thinking about producing policy and programming to produce healthy child development for children within a defined geographic area or place. So it's localising that big agenda. And more specifically, it's a set of conditions that occur within that place to bring about change within the local service system and the community more broadly. And it's those changes at that systems level, which we talk about, not at the program level, systemic change, community change, that is going to produce the better programs and the better outcomes for children. It's not a new idea. Community development has been around for a very long time, and it's reinvented and it has different names attached to it. But it's like community development. People might be familiar with the new lingo of collective impact and community action approaches. And it's certainly aligned with initiatives, whole of community initiatives that address the social determinants of health. So programs that look at what some of the risk issues and needs issues are within a community and tackling those in a very evidence-based way. So how does it work? This is my shot at trying to explain it. This isn't in the paper, but just for simplicity's sake and for presentation. I'm suggesting that localised ECD, or localising that agenda, works because it actually tackles those layers of complexity that I spoke about earlier. It tackles the challenges that we face in terms of the complexity of child development, cultural complexity, community complexity and funding complexity. So there are a set of conditions and activities that actually deal with that complexity and produce changes, as I said, in the local service system and the community more broadly, which then in turn produce the better outcomes for Indigenous children. So it's not a program. It's a framework for implementing some conditions that are going to produce a system for early childhood development and a community that is going to produce those outcomes. Okay, that's a little bit complex, that slide, talking about complexity. But there is a special place reserved in my paper for trying to describe the conditions for implementing localised early childhood development. I guess there is a bit of a sea change and an understanding that a localised approach and place-based initiatives can produce benefits, but how do you put policy around that, or how do you make that happen if you're a community leader or you want to do something within the community? There's not a lot of guidance out there about implementing this sort of approach, and I felt that I wanted to try and summarise what was out there into a set of conditions that might be instructive for people that might want to develop policy or actually go about a localised approach. And in an Indigenous context, I've summarised the conditions for localised ECD as really comprising 5 conditions, and that is a shared sense of need for change, community organisation and engagement, flexible funding, Indigenous capacity for ECD, and a strategic action framework. And the paper also sets out the actions that you can undertake within a community to bring about those conditions that are going to lead to a successful and effective localised ECD strategy. So if I just step through these, one of the important conditions is a shared sense of need for change. Community needs to believe that there's a problem and some sense of urgency or need to do things differently, and a reason to bring people together around an ECD agenda. So communicating the science of early childhood development, the importance of early life outcomes, and also communicating child and family outcomes data at the local level can be really mobilising. And certainly where I'm coming from in Victoria, we're seeing NGOs producing child and youth report cards, for example. You know, they're getting that localised census data and other data and showing what the problems are to really mobilise community toward a collective effort. Community organisation and engagement, obviously you need mechanisms and structures for collective action or collaborative working, and you know, having a governance group is a bit of a no-brainer, and consultation, continuous communication with community partners is very important. But what often is not prioritised, certainly in a monetary sense, is the need for a lead convener. Sometimes it's talked about as a backbone organisation or a facilitating partner. A body that is actually going to do some fairly prescribed tasks and propel this agenda. You need somebody that is going to do some real work and lead from behind to make this initiative work. Flexible funding and integrated funding is really important. You need the right resources to implement your strategic plan. And, you know, that can be government funding, but, you know, the income base for these strategies can be quite broad. We know that there's often not enough resources to implement change or to do what communities feel is needed. So it's about leveraging funds from a range of different sources and pooling them and integrating them toward this strategic agenda. Rebekah's already spoken about Indigenous capacity for ECD. Without the very active participation of Indigenous people, elders, organisations and workers, this does not work. Yeah? So that's really important, and it needs capacity building or investments in capacity building in workforce, leadership and governance and organisation. Communities for Children program that Jenny talked about a bit earlier, in some areas, in some Indigenous areas, there was organisations, NGOs from outside the community that came in and acted in the facilitating partner role because the Indigenous organisation didn't have the capacity to provide that role. So there needs to be some investment and strategies to build capacity for Indigenous organisations to be very active in the vision and the strategy and actually implementing the plan. And finally, the final condition is a strategic action framework. And that involves identifying community problems or needs, so doing a statistical profile as well as consulting with the community and getting information from a range of sources to really know what the problems and issues are in the community, and developing an agenda around those issues and setting yourselves targets for change. You know, so it might be immunisation rates, or it might be getting the breastfeeding rates up, or antenatal visits. So, you know, really honing in on what you're trying to achieve and what your outcome targets are. And then evaluating that and over time building in the learnings about what's working, what's not working back into your strategic action agenda. Yeah. So, as I say, there's a lot more detail in the paper around that, but, you know, I did do a lot of reading, and hopefully that summarises what is out there in terms of how to go about this localised approach. So linking back to why it might be a good thing, those conditions and actions that I've just described produce change within the service system and the community that are very important in terms of child development outcomes in the early years. Through the alignment of effort among partners, you get this multiplying effect. The coordinated activity means it's more than the sum of its parts. Everybody's working to a single goal, and you get that multiplying effect. With a range of community partners involved, you get that comprehensive approach, multiple levels of intervention, so that you get interventions directed at the child, the parents and the family unit and the community, all those environments that are so critical to child development. You get tailored approaches, programs and initiatives that address the local determinants of early childhood development and that take account of the local service delivery environment. Going back to Jenny's paper, she talked about Let's Start, which was operated in the Northern Territory. One of their findings was that it didn't work in that particular context because they didn't have the professional staff to implement that program with fidelity. So although it might be a well-evaluated program, a high-impact program, it didn't work in a particular context because they didn't have the staff that could actually follow the model of intervention. So, you know, making sure that approaches are specific and tailored to the community are important. And obviously, valuing and including Indigenous perspectives, building Indigenous capacity and empowerment means you're going to have programs and services that have local legitimacy and credibility and a community strengthening. Yeah? So, you know, they're going to work, people are going to access them and value them. And again, these are not fly-in, fly-out programs, pilots. You know, it's a long-term vision for change within the community that is going to build on the existing service system and be much more sustainable in the long term. So these are the sorts of outcomes that you get through adopting a localised approach, which we know in the literature is beneficial for children. So this is actually my last slide. So what strategies fit within a local ECD agenda? Well, any of the successful, you know, well-evaluated programs that Jenny spoke about, you know, could be in the mix. But once you've brought people together, identified the challenges and defined the outcomes for a community, then they have to say, well, what are we going to do? What strategies are we going to employ? And I've summarised in the paper that there are 3 broad strategies that might fit within the agenda. And the first one is enhancing, thank you, Jenny, enhancing mainstream health, early learning and childcare programs. And this is actually not about doing something new or bringing in a new program. It's actually what's working with there in a very strategic way. It's about ensuring that existing programs are acceptable and accessible to Indigenous people in the community, and that might be about enhancing their cultural competence and cultural relevance of these programs, or doing much more dedicated outreach to make sure that, you know, Indigenous peoples are actually using the services that are already there. So that's an important and very strategic approach or platform within a localised agenda. We know for Indigenous people that achieving better outcome for children is about working with parents as much as it is about working with children directly, and certainly increasing parent education and family support and, you know, investing in that area is really important. And again, there's lots of ways of going about that, and it may be a parenting program, a new service. But one of the things that actually works very well is to build on the existing system and successful programs, and, you know, incorporating parent support and family support into existing services. And particularly what's worked really well is when they're added onto health services, because they tend to be more readily available health services than any other type of service. They're delivered by trained professionals. So just by adding on, you know, an element to that service can be really effective in reaching a broad group of people and actually laddering people to other specialist supports when they're needed. So it's drawing in and laddering. And one of the programs that I talk about, it was developed by UNICEF and the WHO, is Care for Child Development, which actually has modules attached to their antenatal maternal child health programs, which are around, you know, telling the ECD story and getting parents to know the messages about early childhood development and parenting support. And the other one that we know about is intensive home visiting. I mean, that's a health service which has that, you know, parent and family support casework attached to it, which has been very, very successful and is well evaluated. So again, you know, thinking about what exists there, this another term, progressive universalism. It's about ensuring that universal services and mainstream services can actually respond to families with a high level of need. Yeah. And the other strategy, broad strategy, is about addressing fragmentation and gaps. And of course there are different levels of service integration and coordination, so you can go about addressing fragmentation in a lot of different ways. And again, that will depend on the existing service system in terms of what type of cooperation and coordination arrangement you want to put into place, whether it's co-location or an entirely integrated service like a child and family hub, or some more informal information sharing. There's lots of different types of coordination and integrated working that that depends on the local context. One of the things that I do highlight in the paper in terms of addressing fragmentation is about promoting better connections between Indigenous specific and mainstream services as a way of coordinating services and promoting a more comprehensive service for families. So they're the three broad strategies, and I think that's really all that I've come here to say about that. Just that I hope that there are some insights in the paper for you, and that you might be able to use some of them in your professional work. Well, thank you.
Thank you, Sarah. We're going to use the bit of time we have now until around 12:30 for some questions to our presenters. Once again, just signal, raise your hand if you have a question. And again, if you wish to identify yourself when you're asking your question, because it will be webcast and recorded, and that's optional.
Hi, Graham from the Smith family. I just wondered if you might have put it in your report, but the role that the Australian Early Development Index will play across Australia now, it seems to be guaranteed the ongoing benchmarking of early childhood development across the whole of Australia, how that factors into some of the work you've been looking at.
It's an absolutely critical community level indicator for the sorts of localised responses that I'm talking about, and the fact that there are national benchmarks makes it even better. I've just finished 2 evaluations of local Communities for Children programs, and government is actually using the ADI as a performance indicator now, and in terms of that program. So we've got data over time, a commitment to continually collecting it. It's a robust indicator, well validated, it's just fantastic. The only comment I'd make is, in and of itself, it's important to capture a range of indicators. I think it was Tom that was talking about in and out migrations of communities, and one indicator doesn't tell the whole story. You really need to capture a lot of different community level indicators and look for trends across all of those data to be confident that your intervention is actually producing change at that community level or interpreting it. But it's a fabulous initiative and very important for localised approaches.
If I could add something to that, I think the other thing about the AEDI is that basically it's asking kindergarten teachers or first year of school teachers to comment on the level of development of the children who've entered their class, but in different areas of development. So in terms of their language and communication, or their cognitive development and so on, their emotional, social development. And so local communities can look at that data and say, look, we really need a big push towards the social emotional side of things, or language issues seem to be a big thing with the young children in this area. So let's really focus on that. So it can be really pinpoint the strategies you want to use in the sort of approach that Sarah's talking about.
I would agree with all that's been said. I guess, just my only little caveat would be that it's not ideal in terms of assessing children in a very unfamiliar environment in the first couple of days of school or whenever it's conducted. So I suppose I have a few concerns about the way in which it happens and how. But, I still agree that it's fantastic to have a national measure like that, and it's an excellent, indicator. And my only other concern, I suppose, is that it really does, measure those developmental domains, and perhaps, I guess I'm wondering how westernised this measure is. And so, anyway, I suppose I have just a few little concerns. So I think there's some thinking to do about it. But, of course, it's excellent to have an indicator like that. It's an excellent outcome measure.
Graham, gentleman at the back, and then one in the middle.
Thank you, Sarah, for your paper. Very interesting. Graham Bryce from PMNC now, but formerly Faxia. And your paper triggered me, your presentation triggered some memories for me. And one of those was when I was involved in the founding of the Footprints in Time study. And one of the ways that we tried to encourage the Adelaide Aboriginal community to be involved and to support that study was to run a symposium on Aboriginal early childhood here in Adelaide. And it was quite surprising because it was actually turned out to be the first time that had ever been done. There had been no other opportunity to really focus on Aboriginal child development and to get all the practitioners, all the players, all the policy people and some very grassroots people, some grandmothers and some parents involved in that symposium, and it was a tremendous success. So just reflecting on what you've been saying, it seems to have been a way of galvanising what you've done. You've presented a whole lot of principles, theories and I guess components for how to do this well. But that might have been a way of saying, okay, here's a simple way of getting everybody together to really focus on some questions and some current day policy challenges. And particularly what I want to focus on was it was a way of empowering the Indigenous leadership and giving them the sense that they really did matter, and what they thought and what they felt and their experiences and their stories were all directly relevant to policy development and to future research and how you do research properly. So we were trying to sort of dovetail the two areas. We specifically wanted to involve parents and particularly also dads. So some Nunga dads were involved in the symposium. And it went for 2 days, as I said, and there was 95 or 100 people involved. It was a massive success. There were workshops on the second day in small groups, and the outcomes of that were presented and put together in a small booklet afterwards. It just seems the way of saying, okay, here in a big city, a relatively big city, certainly bigger than a lot of other regional centres, it is important to give that opportunity to people. So to focus on the issue and to say we can do better here. There's a whole lot of areas which are not working, and this is a way of getting people together. So just to suggest that maybe to other big cities, there's a simple way of saying, okay, this is a way forward perhaps. Thanks.
Hello. I'm just keen to know whether you have any research data about malnutrition and whether are there any nutrition supplement programs going on, like for anemia or vitamin D or any vitamin deficiencies in children?
There are quite a lot of nutrition programs that are operating across Australia, ranging from cooking programs, so people getting together and cooking together, through to fruit in school programs. There's other programs where fruit's provided in boxes free to family and given information on how to prepare the food in a healthy way and store it healthily and such. So yeah, there's actually a lot that's happening in terms of nutrition, and there are some studies that are demonstrating some outcomes such as improved levels of vitamin C. I guess what I'd say generally about the nutrition level is that the level of evidence isn't high. So there's a lot of research that talks about satisfaction and people reporting that they love going to the cooking program and they appreciate the fruit coming to their homes and all of those kinds of things, but not a lot that is demonstrating change in terms of the health of the children. So I think there's lots of room for some really good work there to look at the impact of those kinds of programs. But certainly there's a range of them operating, and we list a number of them in the paper. You'll see them there in the table. Yeah.
Hi, Andrew Cockington from DCSI. Sarah, probably direct this to you, but the others might have a comment on it. You talked about community a lot, but there are many areas where community is a very complex thing, particularly in the nature of family groups and whether they get along or not. I just wondered what your research or reading told you about how communities can come together in very complex situations at times, and even in the metro area of what is a community. I mean, have you got a comment on that?
I think it's a very fantastic question to ask, but there isn't a lot in the published literature about that, and in fact we tend to talk more about the frustrations and challenges of bringing communities together and groups together rather than some of the strategies that are successful. So I guess there is an acknowledgement in the literature that it can actually be a very difficult thing to do, but in terms of guidance, that's pretty scant. Going back to what I've observed in the 2 Communities for Children sites, that lead convener role seems to be absolutely critical in terms of, the organisation and, who's actually managing it. So it comes down to, I think, personnel a lot in terms of their credibility and authority and legitimacy within the community and their facilitation skills and ability to, bring that community to, together and those disparate people. So, and I don't actually think that that's a skill that is taught, or learned. So I think there's a lot more that we need to learn in that area, and I think we need to encourage our practitioners and the people that are facilitating these types of initiatives to talk and to write a little bit more about it so that those, promising approaches, can be out there. I'm just thinking one of the facilitators in one of these local Communities for Children sites, in terms of bringing together people, came up with this idea of speed dating, which was an initiative where she invited all of the players in the child and family welfare sector within this local community and actually, did a speed dating where they were exchanging business cards. They had keynote speakers and activities at the table. And she evaluated that in terms of, understanding the local community, their intention to work more cooperatively, and then followed it up 6 months later in terms of what they actually did. So there's one example of a facilitator that's, thinking innovatively and actually doing, some really good facilitative work. But no, it's not an easy task. It needs to be better understood.
Hello. I'd just like to say that who's endorsing the AEDI, just to let you know that Jan Oliver and myself are here from the AEDI, and if anyone would like any information, to please see us after the seminar. That'd be great. We'd be glad to speak with you. Thanks very much.
Any more questions? Comments? Jokes?
I don't think this one's a joke, unfortunately, Jackie. My name's John Gray. I work for Audley Paringa Aboriginal Research Unit in Samri, which is just up the road here on North Terrace. My background is in population health statistics. I'm interested that you haven't mentioned the role that poverty plays in explaining differences in early childhood outcomes on any kind of measure. In fact, I wonder if any of you would like to comment on why and what difference that would make.
It would make a huge difference. It's very difficult to disentangle, actually. It wasn't part of the scope of the paper that, so we were very focused on, finding programs that reported on those 3 particular areas. But I think the big challenge would be disentangling disadvantage from, the other issues associated with Indigenous communities. Yeah. Yeah, we didn't do that.
No, just to say, in a truly comprehensive approach, I mean, you would be looking at interventions that focus at that level, at families' ability to meet children's material needs and the economic outcomes of families. And yes, that is part of a comprehensive approach to early childhood development.
And I guess we were reviewing the evaluations. We weren't actually conducting an evaluation ourselves and doing the analysis ourselves. So our paper is reflective of what was presented in others' evaluations, and that isn't something that was seen to, be addressed within the evaluations that we reviewed. So, yeah.
Almost nobody ever uses that as part of their evaluation.
Yeah, but I think it's what you've talked about is fundamental, and it's one of the explanations of where the gaps are coming from and why. And there's extensive literature generally about the effects of poverty on children's development in general, and there are policy responses to that. I know in the US where they're actually giving wage supplements to families in difficult family circumstances, and then tracing the effects on their children's development over years and finding it makes a huge difference just having the money to bring up your children. So that's, it's underlying it all. Isn't it? It's one of the things that you'd expect poorer developmental outcomes for children living in low-income circumstances. And a lot of... Oh, yeah. Yeah. Yeah, that's right.
Okay. Going? One down the front.
I've got a question around the proportions of Indigenous families that actually seek or are interested in using early childhood services, and I'm talking about prior to school. Yeah. And the reason I ask that is because when I did research with Indigenous communities in Central Queensland, and I was working with Durrumble Community Youth Services. Now, a lot of the kids in their families were actually had child rearing roles themselves from the age of 5. And that's not just that, that's a generational thing. So, and let me tell you, when I had my baby, I saw a 5-year-old better dealing with her baby, with her toddler and baby sisters, better than what I could manage the 3 of them. So is there some not understanding about, okay, we recognise that they may be delayed with particular literacy and numeracy, far better when it comes to child rearing from the age of 5, but do we have an understanding of the demand from the community itself for early childhood, of the kind that we associate with early childhood?
Could I answer that? One of the things I've done some research into is Indigenous communities and what they think about early childhood education services. So playgroup, preschool, that kind of thing, and do they want their kids to go there, and what are the barriers and so on. So this was a New South Wales-based project, and the Department of Community Services there was interested in finding out because they wanted more Indigenous families attending the services. I thought that was one of their aims. And what we found was there were numerous barriers to attending these things. So preschools in particular were seen as white domains. The parents bringing their children in often felt judged about their parenting, that they were seen by the teachers, who are generally white people, as poor parents, or their children weren't cared for well enough and all that sort of thing, didn't want to put themselves in that situation, understandably. They experienced racism. A lot of quite a few parents that we spoke to said on the first day they took their child to childcare, they came to pick them up and they were crying and there was no one looking after them and they never took them back. What seemed to make the huge difference was if there was an Indigenous person in the service and they felt they would be looking out for their kid. And that made a huge difference. But there's a lot of work needs to be done to make early childhood education services, or any early childhood services, welcoming places for Indigenous families. You know, like it's just so basic. And there's a great need for further education for Indigenous people to be so that they get the jobs and are working in these services, because that seems to be a key element as well. So we found, we interviewed or had yarning sessions with over 100 families, and in urban, rural and remote areas, and I'd say of those less than a third anyway, had any experience of early childhood programs or wanted to take their children there. In many ways, they were finding what they needed, what they wanted was there in their own community. So there was a lot of more help with childcare than probably non-Indigenous families were used to having access to. And they saw the parents' role as big in teaching children what they thought was important to learn in the early childhood years, which were different things, I guess, from what the white people think were the important things. So that they were teaching their children about kinship, they were teaching their children about culture, and they wanted them to know all these things before they hit school age and got kind of taken off in another direction. So yeah, from the Indigenous families' point of view, there's not, there wasn't that big push. In terms of, I think you were talking about aspirations and so on, that we found the urban families in Sydney were saying they had high educational aspirations for their children. They wanted them to go to TAFE or uni, but we didn't find that in the rural or remote communities. It was never mentioned. So there was a big difference there. And so a lot of the urban families felt that getting their children in early to preschool was the start of that path. Yeah. I hope that answers your question. It's sort of related. Yeah.
I'm going once more around. Okay. Please join me in thanking all of our presenters. Now, there are just a couple of things before everybody moves off. The evaluation sheets that were on your seats, can you please fill them out? And before we conclude, I'd just like to thank FADWA, the Australian Institute of Health and Welfare, the Australian Institute for Family Studies and the Secretariat for bringing a seminar, Closing the Gap, Clearing Our seminar to Adelaide. Thank you, FADWA. And that concludes the formalities. So thank you very much for attending and safe journey.
How to